Good afternoon, everybody. Thank you for joining us for the NAHT. It was an online update that we billed it as, but it's actually more of a meeting for those of you who are working in the alternative provision sector. So welcome to members and non-members who have registered to come along today. My name's Natalie Pettifer. I'm a regional organiser within NAHT. And I'll be facilitating the meeting. My colleague Laura will be putting in links throughout the session on the chat, and just to make you aware that before we start that the meeting will be recorded purely so that we can share it with other members who haven't been able to attend today. So those of you who might want to comment on social media, if you can tag in at NAHT News. Please make sure that you're conscious not to include people's names, for example, on the chat section if you use any photographs, just because purely it's nice for people to be able to feel that this is a forum in which they can share their views and not kind of be put out there wider than the community of the event. So this afternoon, joining us, we've got Rob Gasson, who is a member of NAHT. He is the AP representative on our SEND Sector Council. We've got Cath from the National Association of Hospital Education. She's the CEO of NAHE. And we have Sarah Dove, who is the Strategic Director of PRUsAP, the Voice of Alternative Provision. We've also got a British Sign Language interpreter with us today. Sarah da Costa Bardi is doing that for us. So if you would require interpretation for British Sign Language, please make sure that you select the option to pin her picture on your device. I think that's pretty much all that I have to say. Just to remind you that if you feel free to use the chat to introduce yourselves, to comment, and also if you have any questions, because throughout the session we'll be able to take your questions and discuss those. So please enter them in the chat section there. So before we move on to anything else, I will introduce Rob, who's going to kind of set the scene for this meeting.
Oh yeah, well, I mean, I'd first like to say well done. For getting this far. I don't watch Love Island, and I don't know anything about it. But if there was a version where they put you on an island and gave you ridiculous things to do, I think we've had it over the course of the last 2 years. So well done everyone for making it this far. And nice to see so many familiar faces. I'm not going to talk for long, honest. But what I was going to try and do was set out just some policy headlines really with regard to the NAHT. As I say, I am an NAHT member. I am the AP rep on the SEND Council. I have been for, oh man, I don't know, about 6 or 7 years. It might be longer than that. And I try to represent your views, this sector's views in terms of developing policy around AP for the NAHT. So I know the NAHT's views is alternative provision is a vital part of the education system and gives the most vulnerable and complex students the opportunity to maximise their life chances and provide a child's basic right to an education. The NAHT are real, in my experience, huge supporters of AP and AP leaders and do play a part in terms of helping us develop policy and are plugged in right into the right places in terms of Ofsted and the DFE. And certainly the people I've worked with and the people that I've met through the organisation understand the complexities of the young people we work with, and they understand the issues that we face. And that's right across the sector. Those children that are with us with medical reasons that Cath is such a great advocate for, and who often get forgotten when we're talking policy. I'm sure she'll talk a little bit more about that. And we try and do a little bit of a 1-2 number on that, Cath, when we're in those situations, don't we? But it is nice to be part of an organisation that genuinely understands and advocates on behalf of our young people and the staff, and particularly the leaders that are working in very complex environments that you all know so well. So that's kind of my pitch. This is, for my understanding of what they do and what they continue to try and do to bring quality to our sector and support to those of us who are leading it. Cath, I'll go over to you.
Hello, everybody. Like to echo what Rob was saying about NAHT. I'm also a member and get very good support from them in terms of understanding the AP sector. I just wanted to give you a little bit of an update on where we are and what we've been doing the National Association for Hospital Education with the DFE in the area of hospital schools and where we've got to really. As Rob rightly pointed out, this really has been like the Cinderella service of alternative provision, and that the children in medical AP and hospital schools are very often forgotten because they're not the ones out causing problems. They're either at home or they're in hospital, and they're quiet. They don't really often get considered, and they are a very, very small amount, but still very significant and very vulnerable young people who are equally entitled to an education. I've been in medical AP for quite some time, understatement of the year, and have seen the different statutory guidance being brought in, and each time, you know, the first time the additional health needs guidance was a bit of an appendix to the main AP, but now actually hospital schools and medical AP is being mentioned. If you looked at the COVID guidance, there was actually a section for hospital schools, and there was something about CAMS tier 4 units as well, which is so significant for us. And I can honestly say that the civil servants that we're working with, there's a real appetite to find out what hospital education is, what kinds of children that we provide education for, what their outcomes, etc. And recently we spoke to over 1,000 people at the DFE and the RSC as part of their raising awareness of different areas of education. So that was a really, really good thing to be able to do. And lots of people in the question said, we didn't know anything about it. So that was a great thing to be doing. What we've tried to do at the NAHE is to try and gather intelligence from people working in hospital schools, CAMS units and outreach centres about what is going on the ground, so we can really represent the views and give real stories and real case studies. And Sarah, Rob and myself both all work with medical needs, so we're actually able to give real case studies, and what we found is the case studies really have made the most significant impact. You can talk about increases of number of children with complex mental health. There are no CAMS tier 4 units, the increase in suicidal ideation, but when you can give real stories, that actually has a real hard-hitting impact, and we've had the opportunity to be able to share that. Some of the work we've done, we've made sure that the children who come in and out of hospitals without devices, that we got some allocations of laptops that actually weren't associated to any individual children, so that children that came in were able to access their remote learning. That was a real plus. We're actually working with them. There are some new NHS trusts that have been given money to look at long-term impact of COVID, and DFE are talking to NHS colleagues about how we can join that up and talk about successful education programmes. Fancy that, a little bit of joining up. That would be lovely, wouldn't it? And we really have worked hard on promoting our work with the AV1 telepresence robot that you may have seen or read about, which was part of the Alternative Provision Innovation Fund. The trust of which I'm CEO has picked up that project, is continuing to fund it so that we're getting the AV1s into school, and it's proving to be a really good, sensible, worthwhile solution for children who are shielding, who can't go to school at the moment, and also for schools who then don't have to make special arrangements. That's really been good, and we're hoping to build on that a little bit further. I'm the representative from AP on the consultation that's going on around the CQC and Ofsted inspections of local areas, SEND, and you will have noticed Amanda Spielman's announcement that AP was now going to be included in that SEND review. Isn't that brilliant? We can't wait to have our say in those SEND reviews at local authorities. And the other thing I think that we've really worked hard on is attendance coding. So often in our meetings, they will say things like, oh, attendance is really poor in AP. And we say, no, attendance is good, your recording is really poor. Because so we're working really hard with them on trying to recognise that children who are not physically present in the classroom can still be marked as present if they're attending virtually through AV1, through joining a live lesson. So lots of things going on, and I feel, you know, COVID has been a terrible time, but there's actually so many positives that we're taking forward that I feel really optimistic about moving forward. And I'm going to pass over now to Sarah, because you've heard enough from me.
Thank you so much, Cath. Thank you for allowing me to speak today on behalf of PRUsAP. As explained, it's a national organisation representing pupil referral units and alternative provision. My name is Sarah Dove, and I've worked in PRUs and AP for the last 20 years, including hospital education, 6-day provision and medical AP. I'm not a member of your union, but please forgive me. I'm one of those much maligned consultants, so I just sort of travel on my own a little bit. But regardless, PRUs and AP is a sector that I know and love. As an organisation, PRUsAP has 3 main core aims. That is representation, engagement and raising awareness. If you want to find out more, I'll pop it into the website, pop the website and social media tag into the chat when I've stopped talking as well. When COVID-19 struck, it had a fundamental impact on how schools functioned. And I wrote to the Education Secretary on behalf of PRUsAP members who were particularly concerned about a number of different areas, one of which was around communication with the sector directly and the resources that were made available to us. A line in the opening paragraph of the letter stated, "We are here, we are ready to help, and we are ready to support." This has been a key feature of PRUsAP work on the national level since COVID-19. Cath Kitchen helpfully sent a document before this meeting which outlined all the things that have happened during the pandemic in relation to COVID-19 and pupil referral units and alternative provision. Despite it being in note form, it goes over 2 pages, and we haven't even cheated by putting it in font size 16. I've done lots of highlighting here. Thank you, Cath, for that. It was really helpful. I want to highlight some of the big things that members of PRUsAP have been concerned about and what we've done to try and address them. First, communication was a key area, as already mentioned. There was a strong sense that pupil referral units and alternative provision were an afterthought rather than being seen as a centre stage. And bearing in mind we work with the most vulnerable children, that is something that we wanted to shift and address. As part of this, I'm now proud to sit on the AP reference group with the Department of Education, including Cath Kitchen, Rob Gasson and Mark Vickers and a number of other different people who head PRUs and AP. We highlight some of the challenges whilst also champion the successes of the sector. In doing so, we were able to contribute to the remote learning toolkit that was available for our colleagues in mainstream sector as well as PRU and AP, so they could learn from us too. We've also been active in highlighting the issues relating to commissioning, which adversely affected us during the period in which many schools were guiding their learning from home. Whilst many PRUs and AP may not just offer 6-day provision for children excluded from school, many had also developed positive relationships with schools and the local agencies to prevent exclusions and commission places this way. And obviously, if children aren't necessarily physically going to school, then it might be that there's a reduction in exclusions as well. And this has had a fundamental impact. This meant for some organisations real issues around sustainability and maintaining staff levels. This is something that we discussed and mentioned on numerous occasions within the AP stakeholder group, but also flagging up to organisations such as Schools Week and so on. So there was a bigger national dialogue around that. We were also particularly concerned that as society opened up more and we enjoyed travelling down that government roadmap, it may also mean that some children that we would have missed with those early interventions where PRUs and AP really support would come to the forefront in terms of their challenging behaviour, but also in terms of significant mental health issues and so on. I think the biggest factor that some of the speakers might have had a real kind of understanding around is around the transition fund. Last year, we expressed our worries and provided real solutions on how we could prevent the most vulnerable children leaving school and not being in gainful employment or in their education, because we weren't able to do that kind of physical transition work with them that we might have been able to do in previous years. This was addressed through the use of the transition fund and repeated again this year. and obviously ongoing. PRUsAP then also surveyed those working in PRUs and AP and used this evidence to lobby further funding for this year. I'd like to thank those who were able to complete this survey and engage with this process. You've made a real difference in the lives of the children we work with, and I'm sure that the Transition Fund will continue to do that. Cath Kitchen in particular was, I should say vocal, Cath Kitchen, rather than anything else, was vocal in ensuring that those children on dual registered placements were also seen to be on the same kind of funding arrangements on the Transition Fund as those who were single rolled, because that adversely affects those with medical needs. And looking through this document of some of the work that's been happening, where we've been trying to kind of represent and support the sector as much as we can on a national level, is also liaising with the serious crime and youth violence teams. And some of that work is continuing with the violence reduction units and doing work around that, about how can education support with the reduction of violence. Giving written and oral evidence to the all-party parliamentary groups for AP and exclusions being a key area. Mark Vickers and Cath Kitchen have been invited to talk in those forums as well. And the list carries on. So the ideas for alternative provision acting as multi-agency hubs, and some of you might be part of that work, where there are high incidences of youth crime, including which agencies should be included and how they should work. But we've also been working at other organisations such as the Centre for Social Justice and so on, and regular liaison about their projects and their toolkit, making sure that work streams are aligned rather than this disjointed approach where people are saying different things. But also by being really mindful about the fact that being on the stakeholder group, there is lots of confidences that we're not allowed to betray, and we have to behave in a certain way. Rob obviously, bucks that trend somewhat with his behaviour. But generally, the idea is that we try to work with the DfE about representing the sector as much as possible, as well as providing appropriate challenge as well when necessary. And really, I think I'm taking Cath's words here, really. So thank you, Cath, for writing this. But I think it's something that we can attest to as well. We'll work with any partners who will approach us. And we'll always join in with different consultations to ensure that the AP views are represented as much as possible. And I just want to take this opportunity to remind people very strongly to respond to the behaviour consultation that is out in the moment with the DfE, because our voices are really important. And I know many of those questions in the behaviour consultation aren't necessarily directly relevant to our work, because we might not have isolation rooms or removal rooms and so on. But it's really important that we put what we do around behaviour into that consultation, because otherwise an opportunity is missed about the great work that we do. I don't want that consultation to be dominated by mainstream schools, because actually you work on a daily basis with children who have the most challenges and difficulties. And I think on that note, that's me done. I probably haven't spoken enough.
Thanks, Sarah.
I've got times here and everything, but I've just ignored it, to be honest, Rob.
Sarah, that's great. Thank you. And we're going to move to questions in a minute. But what I thought I'd try and do as well is we've all sat on the AP reference group, which is, we have direct access to the most senior people in DfE, and we meet with Vicky Ford, the Children's Minister, every 6 to 7 weeks. Now, obviously, a lot of what we're doing is confidential, but I don't think I'm giving away any confidences in saying that, there will be in the SEND Green Paper when it's released. We'll have a section around AP, and the kinds of conversations that we've been having are around, and I'm reading from a presentation I did recently to the Head Teachers Board in the Southwest. So some of this is my view, and some of this is views that we just have to accept, is that nationally and regionally, what we see is we see poorly commissioned alternative provision, we see poorly funded alternative provision, we see poorly led alternative provision, and poorly used alternative provision, and obviously the use by local authorities largely of unregistered alternative provision, which I'm frankly not a fan of, because I have concerns not for the people that are necessarily working in that, but what the system is doing in terms of pushing children into unregulated provision. And what we're trying to work towards is a model where AP, PRUs have the same status as everywhere else in the education system. I've worked in this sector, like Cath, a very long time, and I'm used to having those conversations where people talk about PRUs and they say, PRUs, oh, you work for an insurance company, do you? because they have no concept of what we're doing, many people. Now, I think that's changing. Again, Cath and I have worked with it on various DFE bodies since about 2007, something like that, I think, Cath. And these things tend to be cyclical, but at the moment, I really do feel that we are plugged in well, and more importantly, the needs of our young people are plugged in well to the most senior people who are developing policy in education in the country at this moment in time. And that we are trying to represent the voices of you, the voices of our families, the voices of our young people, to ensure that the education system gets as much of a tweak as politics will allow and as funding will allow. But there has been, I think, real movement in terms of, and someone described, potentially placing alternative provision and PRUs as the kind of A&E of education, because what we know we're really good at is assessing pupils quickly, determining what their needs are, and then, if we're lucky, moving them on to somewhere that can meet their needs, and if we're not, then obviously meeting those needs ourselves. And what I mean by that is, that sort of corridor to more specialist provision that many of us provide, but don't necessarily receive the funding for, or necessarily are set up to do, because we have to, as you know, take what we've got. So I do think, at the end of 2 incredibly long and complex academic years, that I'm feeling like the others really confident and positive going forwards, that we have a real chance to try and affect some change. And I'm really hopeful that when that green paper is eventually published, that the stuff that will be in there around APs and PRUs will be stuff that all of us, it'll be music to our ears. So yeah, that's where we are on all that.
Thanks, Rob, for that. Yeah, just to sort of pick up on the points that you've been making, obviously about the green paper, with the timing of this was we hoped that it would be available beforehand, which is why we kind of build it as an update. And obviously we'll be happy to set something up again for people to come together to discuss that once that's published. So talking about the funding cuts, and you've mentioned lack of regulation, so it makes it difficult to ensure quality for children and young people, and also the current commissioning model, with the year-on-year changes, which can affect what's actually available for children and young people as well. After this meeting has finished, I'm going to send an email out to everybody just asking you if you're able to complete a very short survey for us, because we do recognise at NAHT that while we obviously have members who work in alternative provision, we haven't necessarily ran dedicated events and meetings for them in the past, and we want to build on from today and continue to do so. So I'll send that survey out, and that would be really helpful if people are able to respond. Thank you. And I know you're really busy, so no rush. If you can do it over the next couple of weeks, that would really be appreciated. Okay, I haven't had any questions come up so far in the chat, but what I'm happy for people to do is, if you want to either use the icon on your screen to raise your hand on the reactions tab, or just to physically raise your hand, put your camera on if you have a question that you've got for anyone from the panel, or any comments that you'd like to share with anyone within this forum. I know it's the end of another long day, I'm sure, for everybody on the call. But obviously it's just an ideal opportunity having others from the sector on this call with you to get feedback, or just to bounce ideas, or just share your thoughts about any of the issues. Eileen.
Hi, it's Aileen, St Matthias in Bristol. It's a question to the panel really about the sustainability and what we can do as a sector to make it more sustainable. With a lot of PRUs or APs have been negatively affected with lack of referrals from COVID. And is there a push to maybe have something a bit more sustainable funding model that would suit the retention of staff, and make sure that we've got a really positive way to go forward with it?
Aileen, thanks for that. I can say some of what we've been doing. So we've been promoting a minimum 3-year funding agreement that isn't a bums on seats model. And actually we've kind of devised with Nick, who's also on the panel, a model where we would hope that the permanent funding with that commissioning model would be at least 80% of our income, because generally 80% of our income covers our staffing costs. And therefore, you know, with the tide going in, tide going out approach of AP funding is really not sustainable. You know that, we all know that, those that are suffering from that. Now, I actually have a couple of commissioning agreements where that isn't the case, where we have a 7-10 year deal, and actually they are much more sustainable in terms of the funding. And that means that, you know, staff turnover, staff recruitment is, well, generally easier there. At least I know I can afford to pay people before I actually employ them. So we're promoting that, and we've received, you know, really positive responses, but obviously we've no idea what will happen when that goes through the various government machines it needs to go to come out the other side. But I haven't heard anyone yet who says that what we're proposing with regard to a minimum 3-year and possibly 5-year model isn't the right thing to do, because everyone recognises, and because the national data shows that actually if you're in a PRU, you're more likely to be taught by an unqualified teacher or a supply teacher. Now, I know in lots of our organisations that's not true, but I also know in many of the organisations of people who are in this call that I work with, that some of the funding models are frankly ridiculous in terms of top-ups, and particularly when you go over PAN. And actually you're having to go over PAN just to survive. And the knock-on with the complexity of the young people we're seeing is, you know, if the government want to fix those cold spots, if they want to ensure that there is high quality AP, it's got to be funded, and it's got to be funded in a way that is sustainable. So we're pushing for that hard, and we're absolutely advocating on everyone's behalf for those. What we've suggested, therefore, is that the DfE should think about providing and promoting pro forma commissioning agreements for local authorities, that they should ensure that the funding and commissioning of AP is not a bums on seats model, that for the academy sector, that they prioritise the TCAF bids, you know, those expansion bids, because if they want organisations, if they want PRU MATs and academies to grow, then actually they've got the levers to pull to do that. Now, what we do know historically is that central government isn't a big fan of telling local government how to spend its money, in case, particularly high needs budget, in case it gets the responsibility back. But I would hope that with all the lobbying we've done, that they understand, and actually what I've heard people say is that they understand that commissioning this properly and ensuring that we have, you know, as I say, pro forma commissioning arrangements that allow us potentially to work upstream when we're not full, so that we can do the prevention stuff and agree on what those KPIs look like for our sector, that they understand and see the sense in that. But I also think we can do a lot of that ourselves. You know, I'm happy to share the commissioning document that we have with Cornwall and that we have with Devon. The only part of them, in fact, they're going to be on our website soon. They're not yet, but they will be. And the only bit that's commercially sensitive, the finance bit, isn't there. But I'm happy to have conversations with people about that. And, you know, where we've gone in Cornwall is we are strategic partners with the local authority. And as I say, signed a 10-year deal. And no one's done that in my experience. And if that's good enough for down here, then surely it's good enough for everywhere, because that is about ensuring that we meet the needs of an ever more complex population. And that if we're not full, and we've still got 817 pupils in my schools today, well, apart from the COVID ones, but let's not even go there, that, you know, that's a model that we know can ensure that organisations not just survive, but actually thrive. So that's what we're pushing for.
And I think to build on that, we've been able to give real examples of what looks like a postcode lottery. So actually what children can access and the kind of curriculum they have is entirely based on where they live and their local authority. And with the narrative that goes on about how poor we are in AP with our curriculum and how we've got to improve it, we've used that as a lever to say, you know, if you don't fund us appropriately, you know, invest in staff, all of those kinds of things. And the key thing, which they're now starting to understand, is actually we need the very best, most highly skilled staff, because we work with the most difficult to engage and the most vulnerable. So therefore, if you don't fund us appropriately, we can't get those outcomes that you keep thrashing us for, because it's just not possible, because at the end of the day we do have to balance the books as well.
I think it also features around, many of us work in PRUsAP in really dilapidated, horrendous buildings, which aren't really fit for purpose and are an embarrassment. The amount of leaking roofs that I've seen in my career in PRUsAP is horrendous. So there's a bit there around how do we build sustainability of the buildings and premises and make sure children have access to resources that are fit for an educational experience, rather than restricting them because actually you don't have the facilities around mechanics or even a kind of kitchen area or being able to change for PE and so on. And that's probably something that you're quite used to. And I think without having those kind of long-term plans that Rob has mentioned, then that becomes really difficult, because actually what you're looking at is, can I hold a member of staff for next year? Will I have enough students that come in and are commissioned, or do I have to have a rolling contract? And that's not acceptable. It's not great for continual professional development. It's not great for the kind of ethos and culture of a school either. And it's not great for children to be able to walk into a place and see, actually, it's very, to me, it's symbolic of not being cared for and thought about. So that's something that we talk about as well, that the commissioning has implications, not just for staffing, but for resources and curriculum, and they all kind of interconnect with one another.
Thank you for sharing those updates and those perspectives on that. Okay, so thank you, Aileen, for putting that forward. Have we got anyone else who's got any questions that they wanted to? Sorry, you got your hand up again. Hello. Oh no, clapping. Lovely. Thank you. So is there anyone else who'd like to come in with any questions or comments at all for any of the panel, or just to share something with the meeting at the moment that we've got? Okay. I mean, obviously, if you're, as people who've taken the time out of your day to attend this meeting, hopefully so far the information that we've had and the perspectives that we've had have been helpful, and also a lot of the information that people have been referring to has been put into the chat. So hopefully you've been able to pick up those links as we've gone along through the meeting as well. Aileen, is your hand up again? Okay, sorry, on my screen it is. That's odd. Okay, so in that case, rather than, obviously we have set aside an hour, but rather than keeping everybody for the sake of it, Rob, if there's anything you'd like to say just before we finish, then I'll hand over to you. But I want to just prior to that, just thank again everybody for attending. If you are not a member of NAHT and you are interested in joining, please do free to look at our website. The link has been put into the chat. And also, if you are a member of NAHT and you'd be interested in supporting other members, which probably seems the last thing on your mind at the moment in this particularly busy time, but actually a lot of people have found that it's a really useful way to just to kind of become a wider part, an active part of their branch and their community. There's a link in there to our website as well for that, and look out for the survey which I'll be sending out afterwards as well, and also a link to the recording in case someone wants to watch something back or wants to share it with others. So thank you again, and I'll hand over to Rob.
Thanks for that, and I'll echo Natalie's thanks for attending. I know I'm an exhausted man talking to a lot of exhausted people, so I do welcome these discussions. I suppose my final one is, my second final one is a challenge really, because when I presented to the Head Teachers Board in the Southwest, what I was talking about is that I was challenging the CEOs and the other leaders around that table, that they need to reach out to us. They need to, they need to help us look after our pupils. But I think the challenge for us all in this sector is actually to put ourselves out a bit, as it were, and to go and seek those people out and demand that they treat us with equal status when we sit down at the table with them. And really, I know that you advocate on behalf of our young people and our families, but our young people and our families are the most challenging and vulnerable people in society. And, I have a burning indignation that gets me up every day to advocate on their behalf. And sometimes that means that I can be quite direct. And sometimes that means that I can be bloody rude, if I'm honest. But I hope always in the right way and always to the right people. And so we are, we're here, Cath, Sarah and I, we're here to support that in the organisations that we're both in and work with, and in their case, obviously lead. But I think together as a sector, we're stronger, and that sharing of best practice, that knocking down those doors to advocate on behalf of our young people, those getting involved right in the centre of those education systems, whether it be fair access or EHE returners, or God forbid, or whatever it might be. So I suppose it's my final challenge is that after when we've all had a nice break over the summer, that we come back refreshed and we really go at the throat of some of those obstacles that are in the way of us advocating on behalf of our young people and ensuring that, whether it's commissioners or whether it's schools, that our young people get the deal that they deserve. And I'll just finally finish then on and just saying thank you. I know, as I say, how hard this job is. And I also know that if we're not careful, none of us at our level get any thanks. So thank you for giving up your time today. Thank you for coming. Thank you for participating. And thank you for continuing to do a wonderful job with the most challenging and vulnerable young people that are in society. And please ensure that you look after yourselves and you have a really good summer break when it comes.
Definitely. I do hope you manage everybody to get some rest in this call. Thank you again to our guests for joining us and to all of you who've joined the meeting today. Goodbye.